Hello, my brilliant future nurses. Today, we are going on a fantastic journey inside the human body. We will explore the musculoskeletal system. Imagine your body is like a tall, strong building. What does a building need to stand up straight and not fall over? That's right, it needs pillars and a sturdy frame. In your body, the bones are those very pillars. They give you shape and support. Without them, you would just be a wobbly puddle on the floor. This amazing system is made of three main parts: bones, joints, and muscles. They all work together in a super smart team. Now, what do these parts do? Well, the musculoskeletal system has many important jobs. Its first job is to give your body its shape, just like a skeleton does for a Halloween costume. Another job is to help you move. You can walk, run, dance, and wave hello, all thanks to this system. It also acts like a bodyguard for your important internal organs. Your skull protects your brain like a helmet, and your ribs guard your heart and lungs like a cage. For you, as nurses, understanding this system is extra important. It helps you understand how patients move, why they feel pain, and how to help them get better. Before we dive deeper, let's learn about a special pose called the anatomical position. Picture a person standing straight up, with their feet flat on the floor and slightly apart. Their arms are hanging by their sides, and their palms are facing forward, with thumbs pointing away from the body. Why is this so important? This position is a universal starting point for healthcare professionals everywhere. It helps everyone describe the same body part in the same way, avoiding any confusion. When a doctor says a wound is superior to the knee, you'll know they mean it's above the knee, no matter how the patient is sitting or lying down. Think of it like a map's compass. North is always north, right? Similarly, the anatomical position gives us a clear and consistent map of the human body. This allows for precise communication, which is critical in nursing. When you document a patient's condition, perform a physical assessment, or explain a procedure, using directional terms based on this position ensures everyone on the healthcare team is on the same page. It's a fundamental skill that makes you a safer and more effective nurse. So, always remember this standing straight, palms forward pose as we explore the amazing pillars, connectors, and motors of the body. Let's zoom in on the bones, the amazing pillars of our body. Bones are living, growing tissues that are much more than just a hard frame. They are like busy factories that store minerals like calcium and produce blood cells. There are 206 bones in an adult human body, and they come in all sorts of shapes and sizes. We can sort them into 5 main types. First, we have long bones, like the femur in your thigh, which are longer than they are wide and act as levers for movement. Then there are short bones, like the carpals in your wrist, which are cube-shaped and provide support and stability with little movement. Next up are the flat bones, such as your sternum, or breastbone, or skull bones. Their job is often to protect your delicate organs or provide a large surface for muscles to attach to. Think of them as shields. Then we have the fun ones, irregular bones. These have complex shapes that don't fit into the other categories, like the vertebrae in your spine or the pelvic bones. Their unique shapes allow them to do special jobs, like protecting the spinal cord. Lastly, we have sesamoid bones, which are small bones embedded within a tendon, like the patella or kneecap. They protect tendons from stress and wear. Have you ever wondered what's inside a bone? Let's look at a long bone, for example. The outside is covered by a tough membrane called the periosteum, which is full of nerves and blood vessels that help bones grow and heal. Right underneath is the hard, dense, compact bone that gives the bone its strength. Inside that, you'll find spongy bone, which looks like a honeycomb. This structure makes the bone strong but lightweight, and right in the very middle of the long bone is a hollow space called the medullary cavity. This cavity is filled with bone marrow, which is the amazing factory that produces our blood cells. Bones aren't static. They grow and change, especially when you are young. This process of bone formation is called ossification. It happens in 2 ways. One way is intramembranous ossification, which forms the flat bones of the skull. The other, more common way is endochondral ossification, where cartilage models are slowly replaced by bone. In long bones, growth happens at a special area called the epiphyseal plate, or growth plate. This plate of cartilage continues to make new cells until you reach your full adult height, when it finally turns into bone. Understanding this is key for nurses, especially when caring for children with fractures near these growth plates. Now that we know about bones, let's see how they connect. Bones don't just float around, they meet at places called joints. A joint, or articulation, is where two or more bones come together. They are the body's connectors, and their main job is to allow movement. Imagine your skeleton without joints. You would be as stiff as a statue. Joints give us the flexibility to bend, twist, turn, and move in countless ways. As a nurse, you will frequently see patients with joint problems, like arthritis or injuries from sports. So understanding them is super important for providing excellent care. Joints can be classified based on how much they move. First, there are fibrous joints, which are connected by dense fibrous tissue and don't move at all. The sutures in your skull are a perfect example. They hold the skull bones tightly together to protect your brain. Next are cartilaginous joints, where bones are joined by cartilage. These allow for a small amount of movement. The joints between your vertebrae, cushioned by intervertebral discs, are cartilaginous joints that let you bend your spine slightly. They provide a perfect balance of sturdiness and slight flexibility. The most common and most movable joints are the synovial joints. These are the superstars of movement. Think of your knee, elbow, shoulder, and hip. What makes them so special is their structure. The ends of the bones in a synovial joint are covered with smooth articular cartilage, which is like a slippery cushion that reduces friction. The entire joint is enclosed in a capsule, and the inner layer of this capsule, the synovial membrane, produces a lubricating fluid called synovial fluid. This fluid is like oil for the joint, allowing it to move smoothly and without pain. This intricate design is what allows for the wide range of motion we enjoy every day. Synovial joints themselves come in different types, allowing different kinds of movement. There are ball and socket joints like your shoulder, which allow movement in almost every direction. Hinge joints, like your elbow and knee, only allow bending and straightening, just like a door hinge. Pivot joints, like the one at the top of your neck, allow for rotation. There are also condyloid, saddle, and plane joints, each with its own unique movement capabilities. For nurses, knowing about joints is vital for things like positioning patients comfortably, helping with physical therapy exercises, and caring for someone after a joint replacement surgery. We have the pillars, which are the bones, and the connectors, which are the joints. But how do we actually move them? That's where the muscles come in. Muscles are, the motors of your body. They are special tissues that have the amazing ability to contract or shorten. When a muscle contracts, it pulls on a bone, and that pulling action creates movement at a joint. Without muscles, your bones and joints would just be a motionless frame. You have over 600 muscles in your body, and they do everything from helping you smile to making your heart beat. As a nurse, you will interact with muscles constantly, whether you're giving injections or helping patients walk. There are 3 types of muscles in your body, and each has a different job. First is skeletal muscle. This is the muscle you can control voluntarily. When you decide to lift your arm, kick a ball, or type on a keyboard, you are using your skeletal muscles. These are the muscles that attach to your bones via strong cords called tendons. They are also the muscles you will assess for strength during a physical exam and where you will often administer intramuscular injections, like in the deltoid muscle of the shoulder or the gluteus medius in the hip. The second type is cardiac muscle. This muscle is only found in one place, your heart. Cardiac muscle is involuntary, which means it works automatically without you having to think about it. Thank goodness for that, because you wouldn't want to forget to make your heart beat. It contracts rhythmically all day, every day, to pump blood throughout your body. The third type is smooth muscle. This is another involuntary muscle found in the walls of your internal organs, like the stomach, intestines, and blood vessels. It works behind the scenes to do things like digest your food and control your blood pressure. Skeletal muscles are what we focus on most when we talk about movement. They are organized into groups that work together to produce coordinated actions. For example, you have major muscle groups in your head and neck for chewing and turning your head, in your thorax for breathing, like the diaphragm, in your abdomen for core stability, and in your limbs for walking, lifting, and grasping. As a nurse, knowing the location of key muscles is crucial. Understanding where the vastus lateralis muscle is on the thigh is essential for giving injections to infants. And knowing how the calf muscles work is important when teaching exercises to prevent blood clots. So, we have explored the pillars, connectors, and motors of the body. The musculoskeletal system, with its bones, joints, and muscles, is honestly a beautifully designed machine. The bones provide the structure and protection, like the axial skeleton, skull, ribs, spine, guarding our vital organs, and the appendicular skeleton, limbs and girdles, allowing us to interact with our world. The joints provide the flexibility, with synovial joints allowing for a huge range of motion, and the muscles provide the power, contracting on command to pull the bones and create purposeful movement. Each part is amazing on its own, but their teamwork is what actually makes life possible. For you, as a student nurse, this knowledge is not just for passing exams, it is the foundation of so much of what you will do. When a patient comes in with a broken arm, your understanding of bone structure and the stages of bone healing will help you explain the casting process and care plan. When you help a post-operative patient out of bed for the first time, your knowledge of muscles and joints will guide you in moving them safely to prevent injury and promote recovery. Every physical assessment you perform will involve checking muscle strength, joint range of motion, and skeletal alignment. Think about your daily tasks as a future nurse. Giving an intramuscular injection requires precise knowledge of muscle landmarks to ensure the medication is delivered safely and effectively. Helping a stroke patient with exercises to regain movement involves understanding which muscles have been affected and how to retrain them. Even something as simple as positioning a patient in bed to prevent pressure sores requires an understanding of bony prominences, the places where bones are close to the skin. Your knowledge of the musculoskeletal system will be your trusted guide in all these situations and more. In summary, mastering the musculoskeletal system is one of the most practical and important things you can do. It's not just about memorizing the names of 206 bones or 600 muscles. It's about understanding the how and why of human movement, support, and protection. This deep understanding will make you a more confident student in the classroom and, more importantly, a more competent, safe, and compassionate nurse at the bedside. You'll be able to better care for your patients, educate them about their bodies, and help them on their journey back to health. So,